Jain. Yeah. You have already loaded it.
Yeah, where is it? I sent it to him. Lifespan Pharmaleader. If I'm on. Yes. Thank you. Good afternoon, everybody. Uh, After that stimulating speech by Dr. Mohan, who told me he'll join us back again in the next 2 hours, you all must have realized the dimension and the problem which diabetes is. And I know it more than many other people in this room. I'm a diabetic for the last 20 years. In these 20 years, I've hated diabetes, I love diabetes, I suffered diabetes, I fought with it, I complied with it, I tested it, I neglected it, I remembered, I forgot, I pricked, I avoided. At last, I decided to do something about it. And I envisioned a world without diabetes. Today, after 1 year, we've got 30 clinics in India across 8 cities. Last year, we saw 10,000 patients of diabetes. We touched about 25,000 lives, and we had an 84% patient satisfaction rate. And we've got 150 medical staff working with us. It's actually the world's largest diabetic chain because there doesn't exist too many diabetic chains in the world. Still, our resolution to go bigger, we want next year to be about 100 clinics, to touch about at least 40,000 patients, and to have a 500 plus medical staff. How big an opportunity to do good is diabetes? Dr. Mohan showed you, and we've also got studies that 1 in 4 people in India need help with diabetes. And what Dr. Mohan showed you was actually much bigger, and he knows better than me because the kind of research and the kind of work he's done, I'm a great admirer of his. So therefore, if you see, the opportunity to do good in diabetes is huge. It's the #1 killer in the world, and a lot of people don't know that. Because what happens is, a diabetic dies. Diabetes never kills. And let me explain this to you. When a diabetic dies, he dies because of a cardiovascular disease, or he dies because of a kidney disease, or he dies because of a foot injury. It is never associated with diabetes. So what really happens is, a diabetic dies, but diabetes never kills. The numbers are not there. But when you put together numbers, we realize that diabetes kills more people than combined TB, plus malaria, plus dengue, plus swine flu, plus Ebola, plus HIV/AIDS. If you combine all these deaths, it is still lesser than diabetes. Most of you who would read newspapers know that one day, and for 2 months, we kept hearing about dengue. And the total deaths were 19. So there was a big headline, front page in Times of India, 19 people died of dengue in this month. And I realized that while I was reading it, those many people died of diabetes while I was just reading it. So the problem is we don't understand the dimension of diabetes. We don't understand what it really means and what's the kind of burden which is in this world. Diabetes is the biggest reason for cardiac diseases, blindness. It's the single largest cause of blindness in this world. Foot amputation. Other than accidents, the biggest cause of foot amputation in this country or in any other country is diabetes. And therefore, there's so much more opportunity to do good. And because I'm a diabetic, I decided to do something about it. And like I said, today we are the largest chain of clinics in India and in the world. We had too many challenges, and lots of them. And perhaps the challenges was worse than the disease itself. First challenge is, given the number of diabetics and given the number of doctors, and I know personally, each doctor gives you about 3 minutes, which is just not enough to look at diabetes at all. There's a huge amount of neglect when you go to a doctor. There's doctors, there's time, there's no counseling. What we did, we created massive awareness. Thanks to my association with Times of India, which I earlier used to be on the advisory board, and they're very happy to team up with me, and they gave me a large quantum of advertising. I could create massive awareness about you. Many of you have seen our advertising on Times of India. Sometimes people come and tell me that, look, even before we read Open Mumbai Mirror, we see your ad. No, wait, even if I open my door, I see your ad in Mumbai Mirror, okay? But the simple reason is we have to create diabetes awareness. There is very little awareness on what diabetes and what a problem it is. The second thing is counsel people. We've got a system by which every diabetic has to be counseled for 30 minutes. It's measured by the time he comes in onto an automated system. We have to counsel them for 30 minutes. And we employ only specialist doctors. And I was telling Dr. Mohan, 30% of the doctors are trained by him, and they come to us. And that's something I'm very grateful to him about. Like I told you, diabetes doesn't kill, but it's still the single largest killer in the world. So what do we need to do? We need to create awareness of complication, develop simple, non-invasive tests to screen complication, help avoid manage complications. And we've been doing that in a big way. Most people don't understand, but I do. A diabetic body is the most invaded body in the world. You prick yourself daily. You take insulin 3 times, 4 times a day. If you have a heart problem, you have a heart catheterization. You have foot ulcer. You've got eye testing and the laser. If you can imagine, and people may not imagine this, but a diabetic body is the most invaded body in the world. And what do we need to do? We need to do a lot of non-invasive testing. So we created a test called the risk test, which is US FDA approved. We created a rapid test. We are working on a non-invasive glucometer with some of the best brains in the world. Therefore, we can tell people about their complications, because you don't want your body to be invaded all the time. And because your body is invaded, sometimes you don't measure your diabetes. You don't measure your sugar levels, because you have to keep invading your body all the time. This is the only disease which makes you invade your body every day. A diabetes is not just about the sugar level, but also about the future health. You heard Dr. Mohan said that if somebody gets diabetes at the age of 25, by age of 45, there are good chances of he can becoming blind. And that's what's happening in this country. More and more diabetics being found at the age of 25, 15 years, and 20 years. And how much ever you control your sugar, in about 20 years' time, you will start getting complication. Some of the biggest cardiac hospitals are filled with diabetics, and that's what's happening. What we're doing, we are creating non-invasive testing to create awareness among people to say, listen, the problem has started, be careful. And we've done this with about 8,500 people last year. And we plan to do that with 30,000 people this year. Diabetes is multidimensional, multi-therapy disorder. It's not a single disorder. It's a disorder which permeates the entire body. And therefore, what we've done, we've got multi-therapy experts with us. We've got integrated mechanisms. We've got better medical outcomes. We use technology so that people can call up anytime, talk to us on SMS, talk to us on emails, talk to us on video chats. We're using technology in a big way. Low awareness. We did a survey among 5,000 people, and Dr. Jumani will be glad to know that he knows that erectile dysfunction is one of the biggest causes diabetes. 69% people didn't know about it. When you put an ad saying diabetics have a 50% more chance of heart attack, actually the number is 70%, and Dr. Mohan would correct me on that. The Advertising Standards Council of India went after us, saying you're creating fear. We showed them 10 Indian papers, including Dr. Mohan's paper, and they still live in denial. That's the whole thing. You're talking about an apex body like the Advertising Standards Council of India, living in denial. Actually, the whole country is in denial about this disease. It's such a big disease. So what are we doing? Thanks to my friends in Times of India, we are shouting. We're shouting literally every day to say, look, diabetes is a big problem. Look at it. And that's what we're doing. But that's not enough. We need more voices and noises like the people here. Standardization. We wanted to create something which is highly standard, not just the decor, the treatment, the protocol, education material, everything standard. I call it the macronization of healthcare. We've done it. We've got 30 clinics which look exactly the same. We've got the protocols the same, the software the same, the automation is the same, the routine how a patient goes through is the same. And it's brilliant. We love it. We've got a central team. We've got a team of people who call every patient after they leave the clinic. And they check how was the experience, what happened, what is the patient satisfaction rate. We had an 84% patient satisfaction rate. But you know, in the first month, all the doctors got after my life, saying, how can you check about our services? We are doctors. I said, I don't care. All you're doing is a service. And therefore, we will check what you doctors are doing. And it took a little time to explain to them. They all fell in place now. But believe me, there's no concept called, look, just because I went to a doctor doesn't mean there should be a customer service. The biggest, we get some complaints, and I'm very happy. One complaint came to me saying, the doctor made me wait for 15 minutes. I said, brilliant. We set up a standard where waiting for 15 minutes is also a problem. We all waited for doctors for 1 hour, 1.5 hours. We normally don't like anybody waiting there. It's all by appointment, and we make sure that nobody waits. And I was very happy to receive a complaint saying that the doctor made me wait for 15 minutes. That's setting a new standards. We've got frequent trainings, we've got periodic audits, and we take every customer's feedback every time. There's not enough counseling. What is required in diabetes more than medicine is counseling. Medicine is only 20% of the solution. 80% is counseling. And what doctors give you today, and what doctors gave me, my doctors, and there's some of the large, big doctors in the country, is 5 minutes. We've got a mandated and measured system of giving at least 30 minutes. Sometimes it goes to 45 minutes and 1 hour. And some of my friends who come to my clinic saying, "Main thak gaya." But that's the kind of counseling which we require for diabetes control. Medical mindset. I'm extremely sorry. I work with a large number of doctors, but I'm one of the biggest critics of doctors. Doctors are too individualistic. They're not trained to build organizations. That's why somebody like me had to come and create an organization like this. I'm not a doctor. Doctors not trained for customer service. Doctors are a closed system. What we did with all of the doctors was counseling. We also did something else. We did a fixed remuneration system. Most doctors go to hospitals and work on a patient share, and it leads to all kind of various practices, which we said no. We encourage younger doctors to come and work with us. We said, yes, you are capable of treating diabetes. At 28, we are the world's largest. But believe me, given the problem, we are too small, too tiny. This country can take at least 2,000 diabetic clinics, which is the kind of magnitude we are talking about. So what we did, we said we can't set up all the clinics. So half of our clinics are franchised. This is one of the innovations we did. There's one of the only chains in the world, perhaps, where franchising as a route in healthcare has been taken. People are very bothered about standardization, but there should be quality control, and that's